council members, we'll now pivot to the budget framework that was requested around COVID-19 funding. As you know, we are receiving multiple sources of funding from the federal government, but we also have to be very cognizant about the fluid nature of this pandemic and how we can be mindful and strategic about how to use those limited resources. Obviously, the needs are going to be so much greater than what we have the ability to support, but keeping in mind some guiding principles and some ways of moving forward, our budget staff has been working collaboratively across the departments to make sure that we have a comprehensive look at this. And you were given these materials yet last night, so hopefully you're able to look through them briefly. But I'm going to turn it over to our Deputy CFO, Ed Van Eenoo, to walk us through the presentation this morning. But we have other staff on the line to also answer questions once we get into the details of this framework.
Thank you, City Manager, and good morning, Mayor Pro Tem, and council members. If I could just first ask our CTM staff to switch to the other presentation. This is part of the backup information we provided to you. This is the more detailed table showing the spending framework, but the file I need to pull up is the presentation. All right, so let's just jump right ahead into the next slide, slide number 2, please. And I believe all the council members have this presentation. We sent it out yesterday evening. But on slide 2, you'll see that this work is in response to City Council resolution that was passed on May 7th, directing staff to develop a spending framework for the utilization of all federal sources of COVID-19 relief funds. This is not intended to be everything that was included in the resolution. There was lots of details included in the resolution, but these are some broad points that the resolution directed to staff to take into consideration. First off, maximizing the effectiveness of the use of those federal funds, looking to minimize the impact on our fiscal year 20 budget. I'll talk about that in a little bit. We certainly have some budget challenges ahead of us. To include a timeline for expenditures that aligns with the requirements of each funding source, to include all previously approved council funding initiatives, things like RISE, etc., to allow for flexibility in the use of funds, including a contingency category, to prioritize programs that address the public health crisis and save lives, and to prioritize restricted use of federal relief funds to serve vulnerable populations. I put those all with check marks because I believe that our framework that we're presenting today addresses all of those points. Move to slide 3, please. This was very much a organization-wide collaboration. I can't thank the team members listed on this slide enough. From Austin Public Health, Economic Recovery Officer Veronica Zanio, Economic Development represented by Synovia Holt-Rapp, the Equity Office, Government Relations, Homeland Security, Rosie Trullo from Neighborhood Housing, and Dr. Escott also was able to find time to help guide this and missed all of his other duties. And just to brag on this team a little bit, I have been on at least a couple times a week. I am on calls with CFOs and other staff involved in COVID-19 response across the country from large cities, Phoenix, Los Angeles, San Diego, all of the large Texas cities. And I can tell you, I'm not aware of a single other city that's putting out a framework this quickly with this much detail. In fact, I was just on a call yesterday talking to some folks, and one of the cities couldn't believe that we were already presenting this to council this week, that they are targeting June 17th. Roughly a month from today, before they present a framework to their city council, and they were worried about how they were going to be able to accomplish that in the time they had. So just can't speak enough to the evening and weekend hours that the folks on this page put into getting this framework to you on the timeline that we're getting it to you. Just wanted to do a quick recap. I'm on slide 4 now. The budget challenges the city is facing. And I won't spend a lot of time on this because you've seen it going all the way back to April 7th. We provided a quick summary to council, and we haven't changed these numbers. So In regards to the general fund, you can see across a lot of our major revenue sources, we are predicting declines and significant declines in many of these revenue sources. We are currently focusing on and doing our budgetary planning based upon the slower resolution. We think that's the more prudent course of action, the more conservative approach for sure. On that slower resolution, and working with John Hockenose from TXP, we are forecasting a $57.6 million reduction in revenue in fiscal year 2020 compared to what we had budgeted. And then as we look at fiscal year 2021, assuming that we don't have a resurgence of cases and a second shutdown, that businesses are able to continue to operate, to stay open, to operate safely, we would project a lesser impact of $22 million for fiscal year 2021. We do have our first data point we can actually point to. We received our May sales tax payment, which is reflective of March sales. There is a 2-month lag from the time a sales occurred to the time that revenue gets reported to the city from the state comptroller, and our May sales tax payment was down 4.5%, which is better than what we've seen in other large Texas cities, where the range was anywhere from 6.5% decline to 10.7% decline. Statewide, the reduction in sales tax revenues for March sales was down 9.3%. The stay home, stay safe order went into effect on March 24th, so this minus 4.5% is really only a partial month impact, but it does capture the fact that South by Southwest was canceled this year. But in all of that, we certainly anticipate that our June sales tax payment, which would be reflective of April sales, is going to be significantly, it's going to see a significantly greater decline than the 4.5% here. So that's our general fund situation, and we are, as you know, we're taking many actions, hiring freezes, scaling back on discretionary spending, looking to the prudent use of our reserves to try to balance out this loss of revenue. And our goal remains to be to try to end this fiscal year with a 12% reserve level. I don't know that we'll be able to accomplish that, but that is what we're hoping to accomplish, a 12% reserve at the end of this year. We started this with a reserve beyond that. We have very good financial policies. We adhere to those financial policies, and that puts us in a great position to respond to a crisis like this. But if we can manage to be prudent with our reserves, that's a source of funding that will be available to us in the future should we need it, if there is a resurgence of COVID-19 and additional actions become necessary. Moving on to slide 6, the financial consequences of the economic lockdown don't stop with the general fund. In hotel occupancy taxes, we're projecting a decline of $36.7 million. Airport revenues down $68.1 million. And Austin Transportation Department parking fees down $8.9 million. While that comparatively is a small dollar amount compared to some of the other figures on this slide and on the previous slide, that's nearly a 50% reduction in parking revenues projected for fiscal year 20. Move on to the next slide. I want to talk about some of the various federal funding sources. And again, I'll try to be quick here because you've seen a lot of these slides before. But first is FEMA, a Federal Emergency Management Agency, where the federal cost share is 75% and the local cost share is 25%. Which is standard for disaster declarations and emergency response. I won't read all these items, but essentially FEMA expenses are there for our direct emergency response to the event. Next slide, please, is CARES Act funding. And again, you've seen these before, so I won't go through them all, but the biggest source of funding coming from the federal government to local agencies is the Coronavirus Relief Fund. The city's allocation is $170.8 million, and broadly you can see that those funds are available for medical and public health needs due to the emergency, economic support for individuals and businesses impacted by business interruptions, payroll costs of staff substantially dedicated to COVID-19 response. And then they do come with some restrictions. We have to use those funds by December 30th of 2020, and the funds cannot be used for revenue replacement. So we also received additional dollars from various HUD allocations, CDBG, Emergency Solutions Grant. Go on to the next slide. We received funding to aid individuals who are living with AIDS, Ryan White Grant, and the Housing Opportunities for People with AIDS, HOPWA grants. We received additional allocations from both of those. Funding from the Burn JAG grant for public safety, and a $58.7 million allocation for our airport improvement grant. On the next slide, I just wanted to spend a little bit of time. These are some new awards. These are things I have not previously reported to council, but you may have heard of. But I just identify them on this slide as new awards. A community services block grant of $1.5 million came to the city. These funds can be used for employment training and placement, health and nutrition programs, transportation, housing assistance, and also to provide linkages amongst the various anti-poverty programs. And then we also received a $550,000 grant for the CARES Act Provider Relief Program. This is an emergency medical services department grant that will help us reimburse our costs related to uninsured COVID-19 patients. Move on to the next slide, please. There are also a variety, and I've mentioned this before, many other sources of grant funding that received dollars through the CARES Act. And we have city staff throughout the city that are pursuing additional funding in all of these areas. As we get additional information, we will be certain to share that with the city council. And then finally, I wanted to end this section at least with talking about the other local agencies. All the different sources of funding on here is roughly $265 million of funding from the CARES Act. That combined with the various sources of City of Austin funding, the Coronavirus Relief Fund, airport funds, roughly another $250 million combined coming into the Austin MSA. We have just over $500 million of funding from the CARES Act flowing to different agencies to aid with the COVID-19 response. And that $500 million doesn't even account for FEMA reimbursement, which will come later in the process. That's just funding directly through the CARES Act. It also doesn't include any sources of local dollars that are being applied to the crisis response. I'm going to move in now to a summary of our coronavirus spending framework. I do want to point out that you saw it up briefly. There is a second file that provides a lot more detail about the various programs and the funding. I'm just going to try to provide a summary here on these slides. And as the city manager mentioned, we do have staff from various departments to help respond to your questions. But to start off, in creating this framework, we pull all of our team members together and really discuss what the key principles for the framework should be. And a lot of these overlap with some of the principles you saw articulated in the resolution and articulated on that initial slide of this slide deck. But the principle staff focused in on was to make medical and public health response our top priority. And we have heard that not only from our medical and public health professionals, it was expressed in the council resolution. We've heard it from individual council members. We've even heard it from our economic leadership team, who you might think would be primarily focused on the economic recovery of the city, and they are. And in their recommendations, they also believe that we need to make this our top priority. In their words, the single best thing we can do for our economic recovery is to address the disease, to stop the spread, and to get our economy safely opened up again without risking the need for a second shutdown. So they've also prioritized medical and public health needs as our top priority for federal funds. Secondly, that all public health and economic support programs must lead with racial equity. You heard the data earlier today, and you've heard it many times that our Latinx and African American communities are experiencing disproportionate health benefits. And then in our Asian American community, we're seeing and hearing from that community about the business impacts they're experiencing and how they're disproportionate from what other communities are experiencing. So both of these are very concerning, and they are front and center in our consideration of how we develop these specific programs, how we roll them out, how we implement them. Preserving the city's long-term fiscal health is extremely important. You saw the earlier slides and the revenue reductions that we are experiencing. You've heard about some of the strategies we're doing to mitigate that loss in revenue. And again, I talked about earlier that what we're really striving to do here is to maintain our 12% reserve level. So we are strategically looking at the different sources of federal funds, FEMA and others, for city expenditures that we're incurring that would be appropriate for us to charge off to a federal source of funds, which is going to help us keep our budget in balance. And then the city manager led with the final principle that we absolutely need to maintain flexibility in this. Our situation, the public health situation, it seems to continuously evolve, and we need the flexibility to adjust to those circumstances. So we need flexibility in regards to the funding for different programs. As new information comes in, we may decide that it's necessary to shift funding from one program area to the other. Maybe we had too much money in one bucket and we need more in another bucket. So we need flexibility to do that. We really need flexibility in regards to the sources of funding that we would apply to all of these different programs. And so you'll see in the framework, while we identify the types of funding sources that would be appropriate to use for the different programs listed, we're not specifically saying there is a specific dollar amount that must come from this funding source and another dollar amount that must come from a different funding source, because we need more flexibility for that. We have a whole city staff team set up, staff from our controller's office, from Homeland Security and Emergency Management, and the budget office that are carefully looking at all the different expenditures as they're occurring, identifying the most appropriate and most strategic source of federal funding to apply those expenditures to. And again, as this situation evolves, in order to maximize the use of those funds and to minimize the risk of claims being denied, we need flexibility in regards to which sources we apply to which programs. And then finally, the future is, of course, uncertain. We don't know if there's going to be a resurgence or what's going to happen with the number of cases, if there'll need to be a second shutdown. The resolution from council identified the need for a contingency fund, and we are proposing a contingency in this plan that I'll lay out here briefly. Let's move on to the next slide. This is just a 50,000-foot look at the spending framework. In total, we have $270.1 million of spending that we estimate will occur across these four broad categories. Economic support, $101.2 million, and I'll provide a high-level summary of these different categories in the slides coming up next. Emergency response, $98 million. Medical and public health needs, $37.9 million. And contingency funds, $33 million. This $270 million is the sum total of our coronavirus relief fund, all those different grants we've received from HUD and other federal agencies. It envisions $25 million of our general fund reserves will be drawn down as part of our overall response plan. Remember, we started the fiscal year about $25 million ahead of our 12% policy, and our goal is to end the year at that 12% policy. But that does give us $25 million that we can apply, and of course that's our most flexible source of funding. And it also includes an estimate for what our FEMA reimbursements will be, and of course that's just an estimate. It could be more. The one thing it doesn't include is the airport grant of $57.8 million. That grant is very flexible in regards to the airport uses, but it stops at the airport. That airport grant couldn't be used for any of the programs listed on this slide, so I didn't include it in the total, but just please know that there's an additional $57.8 million that's flowing to our airport to meet their operational needs. So let's move on to the next slide. I just have three of these, or actually four of these, to provide you a high-level summary. These track to the more detailed tables that we provided in the other PDF document. But in regard to emergency response, a $98 million estimate for programs such as emergency management, operations of the Emergency Operations Center. This is our direct response to the pandemic, including operational and programmatic adjustments. that are needed across departments to respond to the COVID-19 pandemic. It also includes payroll expenses for staff that are substantially dedicated to COVID-19 response, and in particular public safety and public health personnel that are that have had to substantially shift how they operate, the manner in which they operate, in order to safely operate in a COVID-19 world. The funding sources here, a lot of this will be reimbursable through FEMA, but also the Coronavirus Relief Fund, and then the operating budgets of our department, to the extent they have funding already in their budgets for various programs that could be used for COVID-19 response. That's also a source of funding here. I'll highlight on this slide, down at the bottom, we put the little footnote that this is subject to change, and also want you to be aware that these estimates are inclusive of any prior actions that council has taken. So for things like the RISE program, when we get the economic support, that's included in these. We move to the next slide, please, and this is where we talk about our medical and public health needs with an estimated amount of $37.9 million. Again, we're using estimate throughout here because we fully envision that these numbers may need to shift as the situation evolves. But this funding would be broadly for programs including protection of vulnerable populations. So this would include nursing homes, assisted living facilities, long-term care facilities, people experiencing homelessness, etc., would all be captured under protection of vulnerable populations. It includes funding for testing, epidemiology response, planning and research, shelters and quarantine facilities, various public health and safety measures, education, outreach, medical and protective supplies. So essentially all the things we feel need to happen in order to get in front of this disease, continue to slow and eventually stop the spread of the disease, and to avoid resurgence and the need for a second economic shutdown or beyond a second even. This is the source of funding. And again, we did make this our top priority, although the dollar amount is smaller than what you're seeing for emergency response and economic support. This is where we started. Our task to the health department was to give us the budget estimates that you need in order to accomplish the task that has been given to you. And this is what they came up with. In regards to economic support, this is a long list, so I won't read all of these, but $101.2 million to fund the RISE program, Anchor program, and various other programs that council has already approved, but also a whole slew of additional programs that our economic support team felt were necessary to provide relief to businesses, artists, musicians, not-for-profits, and individuals who desperately need help during this difficult time. Not only is this the, I'll go on to the next slide. I'm sorry, I should have, I just go to slide 19. That's what I was just speaking to. And let's move on to slide 20 now. And still within that economic support category, you can see that there are a lot of different funding sources that come to bear here. The Coronavirus Relief Fund, the various sources of HUD funding, and Austin Energy and Austin Water have both increased funding to provide utility bill assistance to low-income families, and then our general fund reserves will also be appropriate here. So let's move to the next slide, the final category being contingency. Staff is recommending that we withhold $33 million of available resources for future uncertain needs. This is roughly 12% of that total. Really just coincidental. That's about the same as what we strive to keep in our general fund as a prudent reserve policy. We didn't design this to land there, but that is where we ended up. $33 million to address any additional medical or public health needs as they arise, including if there's a need if there's a resurgence of the disease, and we need additional supplies and equipment and testing, etc. But it also provides us flexibility if we end up having higher than anticipated operational expenses related to our COVID-19 response. Please keep in mind these are all estimates and it's a very fluid situation. It'll give us the ability to pay for expenditures that perhaps are disallowed by the federal government from some other funding sources. Again, we have a team dedicated to this, and I don't think this is going to happen, but this contingency gives us some flexibility should that occur, and then just broadly flexibility to adapt to changing conditions. I only have two more left. If we could go to slide 22, please. Just in regards to timing considerations. There's really only two big timing considerations. One had to do with the $170.8 million coronavirus relief fund, where those dollars must be expended between March 1st, 2020 and December 30th, 2020. What does expended mean? Does that mean that we could encumber the funds on December 30th and say, they've been encumbered. We've incurred the expenses, we just haven't paid them out yet? No, I don't think we could do that. The Treasury Department has made it clear to us that when they say expended, they really are talking about money out the door, checks cashed by December 30th. The Coronavirus Relief Fund is here to address the immediate response, not for departments or cities or jurisdictions to try to create a kind of a rainy day fund out of. The second consideration has to do with FEMA reimbursements, which the city has from March 25th, which was the date of the Texas Disaster Declaration, until September 21st, 2020, to incur costs eligible for FEMA reimbursement. And then finally, as you look at all those different programs, we have tasked our operating departments, and they are prepared to phase the dollars for those programs in over the course of the next 6 to 8 months, so that we have the ability to not only address the many current needs of the community, but also future needs that the community may have related to COVID-19. So on the final slide, next steps. On May 21st, just 2 days from today, you'll see on your agenda numerous budget amendment items to appropriate these various sources of funding. There are budget amendment items for the Coronavirus Relief Fund and many of the HUD funds. You'll also see many items for the approval and ratification of numerous COVID-19 related contracts, so that we can then start moving forward with expending these dollars and meeting the community's needs and public health needs. Additional work that will occur after that will be contracting, developing additional contracts, getting those contracts in front of the City Council for continued program implementation. And we are now going to be shifting our gear towards documentation of all these expenses for the federal reimbursement process and financial reporting, so that we can report back to Council on a regular basis how we're doing in regards to expending these funds and meeting the financial needs of the city. That concludes my presentation. I do again want to thank everybody on the team who just worked an incredible number of hours to get this done on the time frame that we had to get it done in, and they are on the line to help me with questions that you may have.
Thank you, and I appreciate that. Colleagues, it's 11:40. We're going to go through. Again, we'll kind of rotate through. If you can keep your questions, to a little bit, so that way we can move through. This is our staff, so we have greater flexibility with them. And it's my suggestion that we address more of the kind of the framework and the cluster framework that's been presented. I'm not sure, I haven't had a chance to actually go through to look at the numbers and the like, to go to Councilmember Poole's question earlier. It'll be good to actually have this, be able to review it, maybe ask more questions on Thursday, be able to address it obviously in more detail at a special next week. So I think that probably the most important feedback we could give or questions we would ask would be talking about the framework more generally than trying to move things between things. That said, Mayor Pro Tem, you want to start us off?
I had a question about the RISE allocation. Is that a 15 million additional, or is that the same amount that was already allocated?
That's the same amount, and I think you can see that a little bit more clearly. Are you looking at the spreadsheet, right?
Yeah. I was. I'm not looking at it right at the second, but I looked at it this morning.
Yeah, so the column on that spreadsheet that says estimate is the total estimated spending for each of these categories, and then the column to the right of that speaks to what council action has already occurred. So from For the RISE program, that line there is the $15 million that also previously.
Okay, and I guess, Mayor, well, first of all, I'm incredibly disappointed that there is no additional funding for that. And so I'm wondering in this one question round, where are we going to have further discussion? I don't want to hog up the time, but at the same time, I want to know if I just saw that there's going to be budget allocations happening on Thursday, and then I thought you said that we were going to have a special called meeting to look further at these allocations. So how do we have that meeting after we possibly approve some spending allocations?
I think that's an appropriate conversation to have, but certainly funding allocations that are coming up, fair game to discuss in the broader context.
Okay.
And so those things were parallel paths. Staff was responsive to the things that we wanted. That's now coming up. But because we have things coming up on ad hoc, we asked the manager and Ed to come back with kind of a global framework for us. And that's now what has surfaced.
Okay. Okay, and I'll just quickly address my concerns about the no additional. I see increases we've approved specific allocations to various different kinds of funds, and I see increases in almost all of those. I didn't see any increase to the RISE above what was already previously allocated, so that's a concern. The other I saw, and I hate to get into this competing against, because obviously there's incredible need for everybody, but we specifically didn't call, when I was asked questions about the RISE fund, and I would constantly be asked, well, what industries is this for? And I said, we don't want to highlight specific industries because it's for anybody who needs it. We didn't call it, and so I see specific, musician and creative arts, and really anybody could have applied to the RISE fund wasn't called the construction worker, nanny, domestic workers fund. It was called that RISE fund specifically because anybody could apply to it. And so the other just brief concerns are the overall, it sounds like we are absolutely understand the need to get to business, but we're giving more to business than we are to individuals who actually need, really. And so I'm a little disappointed in those numbers as well. So I don't know exactly how we're going to try to move stuff around, but I would definitely like to see an increase in funding for RISE when we're already seeing nonprofits asking for more money through that fund. And I know that there's a nonprofit, help for nonprofits, and RISE money does allocate administrative fees. So if we give nonprofits RISE contracts, they're getting help because they are getting, so not only are we helping the nonprofit, but we're helping them get money out to people who need the money. So I also want to make sure we're thinking about that as we decide where the allocations go.
So if I could just, I don't know if Stephanie is still on the line, but I do know that there was a lot of discussion about the RISE fund, and the item right below it on the spreadsheet speaks about a public health fund. So I think it would be helpful if Stephanie is on the line to explain the additional funding that was included on the $7.9 million for the public health fund and the extent to which that is similar or different than the RISE program. Are you on, Stephanie?
I am on. Thank you, Ed. The department felt like, kind of based upon the information that we have been receiving from our social services branch, as well as our staff that have been, our case management staff that have been supporting the department level operations at the call center. Our folks have been able to provide more like soft referrals and referral, to social service entities that could assist them. But what we keep seeing is that folks that are wanting to not stay at home as they wait for their test results because they can't afford to, or folks that don't have the ability to stay at home the full 14 days to recover. And so we want to establish a public health fund, and that fund will be able to provide assistance to folks that will not qualify for, whether it's unemployment insurance or whether it is the sick leave. But this will provide them some financial assistance, and then they would be able to stay home during that time.
And so maybe it's like a misunderstanding of, I mean, that's exactly what the RISE fund was created for. So I don't know if that's just saying, and I don't believe there's anything in the resolution that created RISE that would preclude us from, instead of it going specifically to a social service contract, that public health would just distributing that money themselves. And so I would say that could be an extra $8 million to RISE, and Director Hayden, obviously they've been able to see where the need is and what's an opportunity to address other kinds of needs that seem to fit exactly with what the purpose of RISE was, and there's I guess, so to speak, problem solved there. I also just want to point out the maps that were just shown, and the disparities and who's it's affecting, and the positivity rates, and many of the social service contracts that are benefiting from the RISE fund are people that are servicing those people, those heat map areas where people are testing significantly higher positivity rates than other parts of town.
Okay, next colleague, Councilmember Kassar, and then Councilmember Tovo.
I appreciate the framework and the prioritization of the public health crisis dollars, emergency management dollars. I think that's spot on. My main concern is relative to what the Mayor Pro Tem just said. I think that adding additional dollars to things like RISE and to individual help makes sense. I know that in this framework, you have some of that with the Public Health Support Fund and with the increased rental assistance. I think that's good. I just think that finding some additional way to add to the RISE money makes sense. I wouldn't want to add additional money to the RISE money by pulling it from other individual supports, because then you're just moving the chairs around the table, but you're not changing anything. And so I wouldn't want to take public health support money and put it to RISE fund, because you're not helping anybody extra by doing that. I wouldn't want to take rent money and move it to the RISE fund, because a lot of the RISE fund is paying people's rent. So I'd be interested in places and us having a continued conversation about how we focus, how we add more money to the RISE fund without taking it from public health, emergency management, or an existing thing that helps individual folks. And I think that does leave some buckets, right? As the Mayor Pro Tem listed, I think there are ways that we can help our nonprofits by having money in the RISE fund that helps them help more folks. I think as you mentioned, our economic expert said that we can help our economy, but what's really critical is for us to make sure that people have the ability to stay home and slow the spread. And so I would look at whether or not some of those very industry specific funds, and instead maybe saying we're going to help people in a variety of industries, or at our balance between business and individuals. That I concur with the Mayor Pro Tem that I would like to see more RISE fund money, but I wouldn't want to pull it from public health, emergency management, or the kinds of funds that are already helping individuals, because that doesn't solve the problem. And then the second comment I want to make is, I do really want to make sure that folks that are working on nursing homes and people experiencing homelessness and workers that are high risk, that our numbers really get thoroughly vetted with people. I'm glad we put these out there, but before we firm anything up, that we really vet those three numbers and make sure everybody thinks that there's enough in those buckets. I'm glad to see them called out here, but I just really want for us to feel comfortable that those are set before we really set up the other numbers. So those are looking at this, I appreciate all the work. But my main two issues are to get more help to individuals out of this balance, and then two, to really vet that those three categories are, that everybody in the community thinks those three categories are covered.
Councilmember Tovo.
Thank you. I am not immediately understanding some of the feedback. And part of it, I guess, is because we haven't yet had an opportunity to really well understand what each of these bullet points mean. Sorry, my dog is being very needy in the background and whining, so apologies for the noise. So, for example, I'm not understanding, and I may just be missing a chart about how this framework is allocating more money to businesses and individuals. And I wonder if we just need to really dig into some of these descriptions. To me, I'm
Do you have
very
the chart with all
concerned.
the numbers on it?
Sorry?
Do you have the chart with all the numbers on it? It wasn't shown on the screen, but it's the second chart.
Tell me which page it is, if you would.
If you look at Ed's email from 7 p.m. last night, there's two attachments, and it's the second
Yeah, I've
attachment.
got them both. Okay, so it's not in the PowerPoint, it's in the chart. Okay, I'll take a look at that. So I would suggest that we spend some time, and I don't know if that's today or in our special called meeting, really better understanding, for example, how these different funds cross. So, as we look through, sorry, now I've lost my page again. I'm interested in making sure that we've got really sufficient funding for rental assistance. I know many of us have had conversations this week with Austin Interfaith, with other organizations about rental assistance. And so, you know, while RISE funding can fund rental assistance, there's also another bullet called rental assistance, food assistance, likewise. So, you know, I think as I look on page 19, I see assistance for individuals. It's just classified differently. So while I understand the interest in having funds with different names, I think we also need to spend some time understanding how much is allocated to these basic needs, to food assistance, to rental assistance, regardless of what fund it ends up being distributed through. And so I guess my question for our staff would be, do you have a sense at this point on page 19, and perhaps it's on the chart that Greg referenced that I'm going to find here in a sec, how much of that would be rental assistance? What the suggestion would be in terms of rental assistance?
Sure, and maybe I could ask our
Oh, I'm
CTM
sorry, I
people.
just see that, 18.6. So would this be in addition to the 1.5 that's already been allocated? This would be additional funding?
I think the 1.5 may be separate. Maybe I could look to Rosie to answer that, but to the extent the RISE program included some funding for rental assistance, we kind of had to make that choice as where we're going to try to organize the expenditures all around rental assistance. Ultimately, we made the decision that we wanted council members to be able to see in the framework the funding for the programs that they had brought forward and advocated for. But we could certainly slice and dice the numbers a different way and say, okay, within the RISE fund, there was this much for rental assistance, which in addition to the 18.6 listed here, you know, gives you a different amount. But that's the reason we organized it the way we did, is we wanted the programs already approved by council to be easily identifiable and kind of mixed up with other things.
And I think there was a question earlier about this, and I'm sorry, I just didn't completely capture the response. Of the items that are on the agenda for Thursday, for example, the contract with Austin Diaper Bank and others, are those reflected in this spending framework? And if so, where? Are they reflected as deductions from the federal money?
Stephanie, can you take that question?
Yes, they are reflected in the RISE, in the original $15 million RISE fund.
Okay, thank you. Are we going to have an opportunity to come back after lunch and continue our questioning, Mayor? Or after lunch, we're switching topics?
You're on mute, Mayor.
You're on mute. Mayor, you're still on mute.
You're on mute.
Sometimes apparently this gets automatically switched. We had talked about ending before lunch, but certainly we don't need to. I mean, if the council wants this conversation to extend farther, we could delay lunch by a few minutes, or we could come back and do it. I don't know how many more people have extended questions. We also have Thursday to talk about this, and we'll set a call for next week as well. Let's see how many more questions we have. Ann?
Okay, Mayor, I will ask a big picture question and then just flag a few things that I can ask offline or that we can talk about on Thursday. So from a big picture question, I'd like to understand, well, first off, let me say thank you for the framework and for pulling this together so quickly. I like the framework. So I appreciate that. So from a big picture perspective, I will want to understand the 33 million in contingency. I'm wondering if there's some estimate around that, or if that's more just sort of what's left. So in other words, is there some thinking about what we must keep, how much we must keep in contingency? So that's one of my questions. And then the detailed questions that I'm going to want to drill into that, Mayor, I'm happy to do offline or do on Thursday. I'm wanting to understand the bucket for nursing homes. Stephanie had mentioned earlier that she thought it was 2.9. I will want to see how that adds up, because it doesn't seem like quite enough to me. I'll also want to understand how much we're talking about for the homeless populations. And the other detailed questions will be around, I'm not seeing any dollars in here related to the Conservation Corps resolution that we passed, which was the workforce related resolution. So I'm going to want to see where that is. I have a lot of questions about the arts ones, about how that breaks down. And then finally, I do hear and understand the concern the Mayor Pro Tem is bringing up about the RISE Fund. And from my perspective, just from an understanding perspective, I'd rather put money more into that fund because it's something we're branded for the community, as opposed to having two funds that do the same thing. So anyway, so going back to my big picture question, the bigger picture question is about the 33 million. So Ed, can you help us understand if there's a thinking that we need to reserve a certain amount, as opposed to that's what we just haven't allocated yet?
There was some thinking about it, but I can't say that there's, an absolute right answer. I can tell you from Phoenix, they are reserving around 50% of their coronavirus relief fund allocation. Personally, I feel that's much too high. That's much too, there's too much of a community need, economic support need, public health need now to reserve that amount of funding, but just saying that was what their staff recommended and what they're proceeding with. When we looked at the 33 million, we didn't have a magic number to it. When we were putting this whole framework together, I kind of stepped back and looked at it from a 30,000 foot level. I got out the calculator, and 33 million is about 12% of the total 270 million that we estimate will be spent on our response to COVID-19, which felt about right. That's traditionally what our city has held back from the general fund, for our reserve. Another thing, I think one of the things that concerns us most is if there's a resurgence of this disease and we need a significantly enhanced or lengthier public health response. If you look at our public health cost estimates of 37.9 million, 33 million is a big chunk of that. So, 3-4 months from now, if there's no additional federal sources of funding coming and there's a resurgence of the disease, not like we had a significant amount of money to meet the immediate public health needs related with the resurgence of the disease. So I'm somewhat rambling, but those are the thought processes that went into landing at that $33 million. And I can't say there's not an exact answer. Different cities are all taking a different approach to this. But I will say most cities are choosing to reserve a much larger amount than what we had set aside.
Okay, thank you, Ed. So to me, that tells me that there at least some room for discussion about that amount, though it sounds like general or magnitude is where we need to be. So Mayor, on my specific questions, I'm sorry, I don't remember exactly what you said with regard to the Mayor Pro Tem's question about process. I was thinking that we were going to be voting on this at some point, and I was thinking we would vote on June 4th, perhaps. So and I apologize, I'm just not remembering quite what you said in response to her questions about next steps. And I can't hear you.
Somebody turned me off again. I won't be voting for the allocation. We won't be voting for the allocations this week. We could see how far we could get next week or not based on the conversation that we're having. I see us continuing to have a conversation about the framework. Certainly, as the Mayor Pro Tem raised, we're being asked to vote on budget items on Thursday. But I don't see us having to decide that today or tomorrow. We'll have a special call, and we'll see if we're ready to do it at that point. If we're not, then we don't. But just having the framework around us, I think, is going to be.
If I could just emphasize that point on the need for getting buy-in and support for the framework, because as we've said a number of times, these are estimates and they will change. And so I don't want to get in a situation where you feel locked into a certain number, because we know that under each of those categories, those numbers will change over time. Every day we're learning more information about what our needs are as a community, and we're going to continue to provide updates for council as we get additional requests and additional needs. But we really hope to get the feedback on the broader framework today to know if we're heading in the right direction. Are these generally the categories that you're wanting us to focus on? Generally the percentages and amounts that you're looking at? But I just urge caution on getting tied into a specific number, because they will change as the situation evolves.
So Mayor, just my last point, and then I'll let it go. But thank you, City Manager. But I personally, just from my perspective, I think we need to take a vote on the framework and the estimates. Doesn't have to be this week or next week. I'm happy with the 4th, but I think that this council needs to take a vote.
Okay, thank you. Councilmember Flanagan and Councilmember Ellis, and then Renteria.
I think the framework is a good start.
Can't hear you, Jimmy.
Hear me?
No, you're faint.
Quiet.
Hear me now?
Yeah.
Put this right up against my mouth. I like the concept of the framework, but I do think it is confusing to have some of the line items be branded concepts and other items be general buckets. I think we kind of need to pick. And to the Mayor Pro Tem's point, like the RISE fund actually solves a number of things because of the way it was created and the way it's implemented. So I don't know that it makes sense to have it as a line on this chart, because it actually does other things. And so I think we just have to pick a style. We're either doing buckets around issues, and then in the details we can say, RISE is a component of this, there's going to be more money for this, there's going to be more money for that. That would make more sense to me, and I think it would actually simplify this chart a little bit. It might reduce the number of rows, so it's clearer about the buckets we've identified and roughly how much of these relative funds we're going to be putting to that challenge. And there are other programs that are created that haven't been named on this list as well. So I think we need to pick a route on that. And I don't know that it matters whether or not we vote for it, because all of these things have to come back to us for votes anyway. So I don't know that we want to get into an old school concept menu style debate on the dais when and none of these numbers are actually allocated in a vote on this chart.
Okay, Councilmember Ellis, I think was next.
Thank you. I really like that idea, Councilmember Flanagan. I don't know if there's a way to blend it in with some of our strategic outcomes so that we can really kind of tie up that framework with issues and then metrics. I think that could work well, but I just had that idea as Councilmember Flanagan was talking, so I haven't really vetted it very thoroughly. But I will also echo the need for more rental assistance. The representatives over at Central Texas Interfaith have crunched a lot of numbers and identified a need that could be up to $40 million. And so I know there's a couple different buckets that have rental assistance. I would support if there's more RISE funding, or if we're able to find other forms of CARES Act or subsequent stimulus packages that could be used for that. But I know there's a lot of families that it really comes down to they need to pay their rent. You know, they want to keep their utility bills in good condition, even though I know we have some customer assistance efforts going on. And some of it just comes down to medicine and things like that. If you need certain prescriptions and you've lost your job, I think a lot of people are really just needing that cash to make sure that those very basic bills are paid. So I'm going to be looking for other ways to identify, and I hope we have your support as well, City Manager, in identifying that ground level rental assistance that so many people are going to need, especially because we don't know exactly where the end is, if it's in sight, and how, you know, our behavior obviously affects this timeline. And so I think that's going to be a recurring issue as the weeks and months go on.
Thank you for making that reference, Council Member. And one thing that we're continuing to try to wrap our arms around is all the different sources that are not identified in this spreadsheet. I mean, this is just what the city might be contributing to these efforts, but there are obviously other places where people can access resources, for example, on rental assistance through the county, through other means. But we need to have a holistic view of that and unified presentation, so we can have that sense of where people can get those resources. But I very much appreciate your points, and I think the points around how do we look at these categories in programmatic areas, et cetera, will be a good next step.
Absolutely, I appreciate that. And I know in our Housing and Planning Committee meeting with the rent program, which I know a lot of people wanted to, you know, they applied for it and there wasn't enough money to be able to go to everybody who did apply. And so I know that your team has identified that need, and I hope that we can work together to find more funding for that. And also for small landlords, people who just have one rental property in the home they live in and are wanting to make sure that their tenants can stay. So I think that's a big conversation in all of this.
Okay, thank you. Councilmember Renteria.
Yes, my question's also on rental assistance. I know that the last time around the rise to $1.5 million, it went to 1,000 people. There were over 10,000 that applied. I think a little bit over 5,000 qualified, and only had that 1.5 million was only to help, could only help a little bit over 1,000 people. I was just wondering, how did you come out? Want to know how they came up? Y'all came up with a number of 18.6 million, and how many would that help? How many people, families would that help?
So maybe I could just speak to the, somewhat broadly to the 18.6 million. I mean, we recognize we could spend we were aware of the $40 million recommendation, and we also recognize we could easily spend more than $40 million. So it's all a matter of balancing all the various community needs against one another and coming up with a broader framework. I'm going to look to Rosie, though, to speak more to the 18.6 million and how many people that will be able to assist.
Hi, this is Rosie. Can you guys hear me?
Yes.
Okay. So we have not contemplated that level of assistance yet and what that program design would look like yet. We are taking into consideration the response that we received from the May rent program that we did with our partner HACA, and would be taking into consideration some changes in program design to make it an easier program to administer, and to potentially bring in additional partners to help with getting the folks qualified, as we have a larger dollar amount to disseminate every month. But we will start working on program design in that vein, based on feedback we get from council.
And those going to be, can you just also, if you don't have that number right now, about how many families with that money, based on the average of what you've seen on the first 1,000 families that y'all helped out, how much housing that we'll be able to, assistance that we'll be able to provide?
Sure. I mean, I would estimate somewhere between, around $1,000 to $1,200 a month of assistance. We would want to hopefully bring in folks for a multi-month program, potentially to qualify them for up to 3 months of assistance. And so I'd have to do the math to work that out. But that's about what we're looking at right now. That could be a little bit less depending on the actual requests that come in and what folks' rental needs are. But that's a good estimate to use.
So it's around, I mean, it seemed like the last around there were about 5,000, a little bit over 5,000 people that qualified for that program.
Yeah, that's correct.
So you're basing it on that 5,000, and then you're dividing the 1,000 that you was able to help out. That was 1.5 million.
Roughly.
Okay, thank you.
Thank you. As you think about programmatically about the rental assistance, or as you go through that, there were young conversations about trying to protect the small landlord that has a couple properties and is now also still having to make mortgage payments, that would have tenants that qualify for this. If there's a way, if a tenant is not applying but would otherwise qualify, we have a landlord like that might be in danger of losing some of the middle missing housing that we have, the affordable housing that we have. Maybe there's a way for that person to be able to also get into that lottery or that draw. And measure with respect to the components on the elements, the reserve I think is going to be really important because we don't know what happens next. And a lot of the modeling we're seeing has us potentially having a second peak, which is going to really exacerbate and change funding models. So while I don't think half is necessary, if a lot of cities are preparing for a second wave, there may not be the same political force to step back in with additional funding for cities. So I think having that kind of reserve is going to be real important for us. I would like to know when you come back so that I can better understand what the assumptions are with respect to how much we're putting against tracing and history, and how much money we're putting against testing in the city, so that as a community we can better understand what is the testing program and what is the contact tracing component, to make sure that we're giving ourselves the ability to scale that operation. I think that if we're in fact opening the economy, the way that that's successful is not only wearing the face coverings and the like, but actually being able to isolate the virus, which is going to require us to do a better job on testing and tracing. And I want to make sure that we have a plan funded for that. Thank you. Additional questions, Councilmember Alter?
Thank you. Ed, I wanted to go first back to the general budget and ask what was the revenue cap level that your budget with the shortfall was based on?
So for fiscal year 21, that $22 million revenue shortfall, we're still assuming in that forecast the 3.5% revenue cap.
And how much revenue does each percentage bring in roughly?
Each percentage would be about $4.5 million. We have to make the difference between 3.5% and 8% to be 24 million.
Okay. So, I mean, a decision that we're going to have to make as a council and the budget is going to be where we want that property tax revenue cap to fall moving forward. And then do we have a sense of what portion of the fiscal year 20 budget got kind of lawfully redirected to these other buckets? Because some people's time is allowed to be covered. Do we know what that frees up? Or is that a conversation we can have outside of here?
We could maybe have a higher level conversation now and get into the details later. But if you look at that more detailed framework on page 1 under emergency response, we're reflecting $30 million for COVID-19 emergency management. That would be a lot of dollars that we think would be FEMA reimbursable, kind of a standard disaster relief type stuff. And we are estimating $68 million of eligible payroll expenses for public safety, public health expenses that would be appropriate under the coronavirus relief.
And that's in fiscal year 20 or 21?
Both. The CRF is between March 1st and December 30th. So we're anticipating over that period, and it's an estimate. It's the best estimate we have at this point in time, and it could evolve. But that's our estimate right now. The eligible expenses we think we would incur in that area.
Okay. So how should we think about that money in terms of the budget, and how you're factoring things over time?
I would think about it in regards to police, fire, emergency medical services, public health in particular, has substantially changed how they operate as a result of COVID-19. And those expenses that's what we're looking to recover through the coronavirus relief fund as an eligible expense. And so shifting the cost to that funding source does help with our budget balancing, and it's part of the equation of how we're going to try to maintain a 12% reserve. It is partly going to be dependent upon how much of those expenses we can recover through that funding source.
Okay, so I'll want to talk more with you about that offline. I have some nitty-gritty questions with that. So at some point, I have several other comments that I want to make, but at some point, I think as a council, we need to have a conversation over sort of when we're providing aid to individuals, what our approach and method is going to be. So the innovation that I saw with the RISE Fund and what I really heard from advocates was a need and a desire to provide financial assistance and allow people to decide where it was best spent to help them. And sort of very large sums that are earmarked for rental assistance is a departure from that. And I think we should have a discussion over what's the best sort of approach for that. I don't have an answer, but I think it's something that we need to better understand. I think we need to do some more rental assistance. I'm not sure how to put a number, because even the $40 million request is just for May. What happens in June? What happens in July? So that concerns me about how we make these choices on that. The thing that I felt like was really missing from this approach is I didn't see any kind of bucket for workforce development. And I apologize. There's folks working on the lawn next door here. So the world has changed, and we're going to need to be able to get people back to work in safe environments, whether it's outdoors or whether it's rethinking how we do our work. And so I think we really need to be able to have additional funding in workforce development, or we're going to need to be retooling the workforce development funding that we do already have in our budget But there are huge opportunities. Like Councilmember Kitchen, I noticed that we don't yet have the Conservation Corps on here, but as a broader thing, people are going to need the hope that having training and some sort of path to something better is going to provide them. And I think we should create space there. We have to respond to the changing need of how work is going to look like. It's going to look and feel really, really different. So I think that's a bucket that is definitely missing from this framework. And I don't think we have enough of that other money elsewhere in the budget that it's easily redirected that way. I wanted to also echo wanting to have more information about the testing and tracing over time, the way that the mayor had asked about that. And I think it's really important that we have that reserve. In terms of kind of what's in which bucket or which fund, there's at least 26 million more that is along the lines of individual assistance, if not more, in here. And so I'm not really caught up on what we call it and what it falls under, but I think we do have a philosophical decision about how targeted we want to be in what we're giving to the individuals and how we want to deliver it. And there may be appropriate times to deliver it one way versus another. And again, I don't have an answer, but I think that's part of what we have to have the conversation about moving forward. And I want to thank staff for putting this together. I think that this is important for us to understand and to think about. I do think that it would be helpful to have a better sense of the time frame for the medical and public health needs that you are planning over, and at what levels. I don't know if most of my other comments were comments, but I don't know if Director Hayden or somebody can speak to the time horizon for the health needs.
Yes, I can. In this proposal, we are looking at the work we would do to the end of this calendar year. And so in this proposal, it includes the number of staff that we would need that would be doing case investigation, as well as the additional contact tracers, as either we hire them or partner with our other partners to get them on board, whether it's internal to the city or externally. We know right now we're anticipating needing an additional 90 contact tracers. And then within this proposal, we are estimating the purchase of 80,000 test kits, and estimating that we would potentially administer about 1,100 of those a month. In addition to that, we are also going to continue to request test kits from the state of Texas to cover vulnerable populations, as well as targeted testing, such as the long-term care facilities. And so we have, we planned out for PPE, et cetera. So we've included that in this plan. And as I said earlier, it will take us through to December of this year.
Thank you. I think that's really helpful to understand it goes through December. I don't know if this is Ed or the other stuff, but if we could get some more information on what we might anticipate getting from the state. We seem to only be hearing about federal funds. Is there any support from the state? I've heard a little bit in terms of maybe some stuff for the nursing homes and the testing, but I wasn't sure how that was factored into this plan.
I think Stephanie can speak to that as well. That's part of the dilemma, part of the flexibility here, that the state does step in and provide a lot of testing supplies and dollars for nursing homes, and the city would not need to put as much into that bucket. And we don't have a firm answer on that yet, but is there anything you would add to that, Stephanie?
You're spot on. I mean, I'll use the example of the nursing homes. For example, we are going to request them to provide us some additional test kits for the nursing homes. They have covered a significant amount of the PPE cost and continue to provide that. And then with the strike teams, they covered the cost of the strike teams. But we're also looking at our grants that we have received some additional funding. Our public health emergency grant, we received an additional $1.6 million. And so with those funds, that has allowed us the ability to set up our platform of Salesforce. That has allowed us to bring aboard the additional 12 people that we have hired, one of which has a focus with the nursing homes. And so we've been able to hire about 4 additional epidemiologists, and we've set up a data team to be able to run the data until we get Salesforce fully operational. So that's just an example of some of the funds that we've received from the state.
And are those in the framework?
I don't see it in the framework, but Ed can answer that better than me.
Was the question, are the state funds included in the framework?
Yes.
No, they're not. Nor are county funds or central health funds. These are funds that are available to the city of Austin to allocate.
And I guess, but we're getting state money for the city to allocate. And that is what I'm wondering is missing. I understand there are other entities helping to address the health crisis, but insofar as the state is paying for a strike force or is paying for testing, is that captured in here?
It's not currently.
Okay, I would appreciate sort of seeing that if we can, or some mechanism to at least flag it as a missing piece of the bucket that could help free up resources.
And Councilmember, we would too. We're just waiting for some additional clarity regarding those funds. And so as we get that, we'll certainly be updating council with that additional information.
Great, thank you.
And if I could really quick on some of Councilmember Alter's points, and let me just step back and say, I truly appreciate everybody's feedback on this framework, and you're starting to sense some of the challenges that we had in putting it together. Any budget process is about trying to match limited resources to greater needs. And, maybe in a normal budget process, we might have twice as many needs as resources. In this process, it seems like we have 10 times the need of resources, or almost unlimited need compared to the resources we have. So this challenge is unbelievably more difficult than even a normal budget process. I did just want to speak to the workforce development, and I'm sure you and Councilmember Kitchen, we have not forgotten about that program. That resolution did thankfully give staff until June 8th to kind of work out the details of it. We are working on that. I just didn't feel we were at a point to even take to make a guess and stick a number on here. So as that program gets developed, we would envision it being added to the framework.
Director Hayden, to the degree that you answered some of the questions on tracing and testing, I'm interested in having a little bit more detail on that. 1,100 tests doesn't get us to where we want to be in terms of testing, so I don't know the context for that. And with respect to the tracing, I hear the number of people. What I don't have a feel for is how many people that's anticipating we're going to be tracing as the world grows, or what assumptions we're making, and how rapidly we anticipate that amount of resources being able to drive us being able to isolate. So armed with that kind of information, those kinds of strategies, that would then tell me whether or not we had enough or whether we needed to be more aggressive in those areas. So thank you for that. Councilmember Poole.
Thank you. Real quick question for Ed. Are the funds for limited? Is Congress adding to their appropriation?
My understanding from our consultant that's helping us through the FEMA process is there's not a cap on our FEMA reimbursement amount, but there
There
is
is not, I'm sorry, there's not,
there is not a cap.
and that reimbursement is the 75% rate, is that right?
That's correct.
Okay, and then with regard to assistance from the state, I wasn't sure if Allison was asking for like funds coming to the city or effort that the state is doing. I know they deployed the National Guard, for example, to go and clean as a strike force to sterilize some of the hot spots, which I don't think we would be able to put a figure to, but are we looking for cash money from the state?
I agree with you. The only thing we'd be able to track would be money that's actually allocated to the city to apply to something like nursing home testing, something like the National Guard. I don't see any way we'd be able to get a number.
So would the legislature have to convene in order to free up to do some budget appropriations in order to get money to the counties? Do we know what the effort is at the state, maybe Bree or someone in the intergovernmental affairs could maybe look at that and let us know?
I'm here. Can you all hear me?
Yes.
Hey, Bree.
Hi, this is Bree Franco, Intergovernmental Relations Officer. To be frank, that I would really not count on assistance from the state. The state doesn't give us assistance normally. They are providing some assistance with the funds they have to cities under 500,000 that did not receive any of the coronavirus relief funds, which is, so you all understand, it was a small handful of less than 20 cities that did receive these funds in the state of Texas. So they're going to provide some money to those cities that didn't, but we are checking every announcement made by the state of potential assistance and tracking that down, but it is going to be far few and limited. The resources that Stephanie is speaking to, and correct me if I'm wrong, Stephanie, is an increase of already existing resources they normally provide to you in terms of grants, and may come down through what was allocated additionally in CARES, to be frank. So the state will not be providing resources. If they did, you're right, Councilmember Poole, they would have to convene. We have not heard of talk of a special session at this point. So they would convene until January, and then that would be for the next biennium, right? So that wouldn't start until the following fall. So that you're looking at, fall 2021, if there was anything there.
And is that an effort that TML or urban counties, large urban counties group, is there any kind of discussion going on statewide?
The discussion right now statewide, at least from this, TML has not started an effort on that issue quite yet, no. And our urban cities will start meeting towards that. On the statewide side, what is being talked at the leadership side is Governor Abbott sent out a statement in an interview with the Tribune saying he doesn't believe going above the 3.5 is allowable in this situation. There's disagreement from TML and other legal experts on that, on the revenue cap. And they also believe that they should look at limiting cities' powers in these situations.
So maybe it's best that we just, okay, thank you. Thanks.
Yeah, you're welcome.
Colleagues, anything else before we break for lunch? Are we okay letting these folks go and picking up the next briefing after lunch? Seems we are. Okay.
Wait, I have a question, Well, my question is just, so does this mean that we will have more conversation on Thursday, or are we waiting until the special call meeting?
I think we'll have more conversation about this on Thursday because we have several budget items that are coming up, and I can't see us being able to discuss those without touching on this. So
thank you.
Thursday, manager, if you could help us with the clerk, get a time next week for a special just on the budget and the framework, financial issues, I think that would be helpful. Councilor Tovo.
Thank you. I do still have contract tracing questions. I didn't realize we would take it up in this, and I guess I'll try to submit them to the Q&A. I know we're all well over our lunch break time, and I'm about to have a mutiny, I think, in my workplace. Quickly, though, I wanted to ask about the Councilmember Alter's CCC idea and where that is reflected within the spending framework. Is that reflected in the piece for businesses, or how is that initiative accounted for? And apologies again if I missed it. I just haven't had a chance to really carefully review your PowerPoint.
So it's currently not reflected, but it's also not forgotten. Staff has been working on it, looking to develop the program. That's a program where there's a lot of existing budgeted funds that we think would be appropriate to use to implement that program. And then we also need to look at federal sources and other sources. But the resolution that Councilmember passed did give us to June 8th to do that work. But just it's good to put everybody on note that we would envision the framework adjusting. That's one of those unknowns at this time, is how much money we would need to put to that program in order to get it operational. We just didn't have a number that I even felt comfortable putting an estimate out there yet, but it's something that we would look to address by June 8th.
Thank you.
Okay, you ready? All right, colleagues, in that case, it is 12:37. Do we want to come back, say at 1:30? Let's come back at 1:30. We're going to do the point in time count. And then go to Brackenridge, maybe the executive session then, or the polled items, and then executive session. Don't know yet. Let's see how that conversation goes. We're going to start with a point in time and then go to Brackenridge. Yes, Councilmember Harper Madison.
I just wanted to ask real quick if you guys would do me the favor of extending to 140. One of my coworkers has a Zoom call. I need to help her get.
140 it is.
Okay, thank you.
Anything else?
Mayor, just I'll note that the ECHO team does have a press conference, and so we'll have to make sure that we can fit it in before they have the formal press conference, which I believe is scheduled for 2:30. And so just note that.
Okay, I think we ought to be able to do that. All right, so at 12:38, then we are in recess until 1:40. Colleagues, us. 5:19. We are back. It is 1:42. Councilmember Harper Madison.
Present.
Okay. Mayor Pro Tem Garza. Mayor Pro Tem Garza. Not here yet. Eenoo. Maria. Not here yet. Councilmember Kassar. Not yet. Councilmember Kitchen.
Yeah, I'm here.
Thank you. Councilmember Flanagan. Not here yet. Councilmember Poole.
I'm here.
Thank you. Councilmember Ellis. Not quite yet. Councilmember Tovo.
I'm here. Can you hear me?
Yes.
Okay.
Yes, Paige, I could hear you that time. Thank you. Councilmember Tovo. I can see you. I can't hear you yet. Can't hear you. But not. You're muted now. Now you're unmuted. Muted. Muted. All right, you might want to work on that. Councilmember Alter.
I'm here.
Okay. The ones I didn't hear from, Mayor Pro Tem Garza, you with us? Councilmember Renteria?
I'm here.
Good, thank you. Councilmember Kassar? Not yet. Councilmember Flanagan? Not yet. And Councilmember Tovo is still working on sound. That gives
Mayor,
us.
can you hear me now?
Yes. Yep, I can hear you now.
Oh, perfect. Thank you. I just need to stop it and start it again.
Good job. Good job. Okay, that gives us a quorum. Let's